A House Foreign Affairs subcommittee is holding a hearing today to discuss the coronavirus outbreak in Wuhan, China, and how the U.S. is responding. Dozens of U.S. citizens stranded in China arrived back in the U.S. today. China struggled to control the deadly epidemic, and now more countries are taking action. Danya Bakish has more.
Hundreds of Americans evacuated from China touched down north of San Francisco this morning in two planes at Travis Air Force Base. One plane refueled and traveled on to Miramar Marine Corps Air Station in San Diego. The evacuees will be held in quarantine for 2 weeks. More than 500 Americans have been airlifted from Wuhan, but time may be running out for U.S. citizens still there. The State Department confirms that after tomorrow, no more flights are planned. An American citizen is among 10 passengers who tested positive for coronavirus on a cruise ship off Japan. The patients have been removed, while the remaining 3,700 passengers will be confined to their cabins for 2 weeks.
The people I feel really sorry for are those with inside cabins who've got no natural light, no fresh air. It's going to be pretty grim for them for 2 weeks.
Worldwide, more than 24,000 people are infected with the virus. Most of them are in China, where social media posts show the tough measures authorities are taking. This woman is said to have been arrested in a grocery store for refusing to wear a mask. In another case, a woman gets into a fight and is beaten after reportedly refusing to have her temperature taken. Other videos claim to show authorities dragging people away after showing symptoms of the coronavirus. And with striking medical workers calling for action, Hong Kong will now require all people coming from mainland China to undergo 14 days of quarantine. Danya Bakish, CBS News, Los Angeles.
Politico healthcare reporter Alice Miranda Ollstein joins me now from Capitol Hill. Alice, you published a story yesterday that says public health experts are worried that the United States response to the coronavirus outbreak could actually backfire. Can you tell us what are the actions so far the U.S. has taken and what's been the response to those actions?
Sure. So there are three sort of buckets, categories of the U.S. response right now. One, the people who are being evacuated directly from the Wuhan area, that whole province in China, are being held under mandatory quarantine for 2 weeks after they arrive, because if they arrive and they test negative, that doesn't mean it couldn't develop. People could have the virus and not show symptoms. Then people from all of mainland China coming back to the U.S. are being instructed, they're being screened at airports, and if they don't have symptoms, they're being sent home to self-quarantine. Basically stay at home, not go out, monitor their symptoms, report to local health officials. And then the other piece of this is a travel ban. All foreign nationals who have been in China in the last 2 weeks are being barred from entering the U.S. unless they have a close relative who is a U.S. citizen. So these are the responses, and public health officials we've spoken to, folks at Georgetown, Johns Hopkins, Yale, a lot of top places, say that all three of these different pieces could have serious problems, both in terms of civil liberties, but also in terms of the public health issue itself.
And, you know, the head of the World Health Organization said yesterday that travel bans and restrictions were needed to stop the outbreak. What are health experts saying that can do if they're not happy with the actions the Trump administration has taken? What do they think should be done?
So the issue with the travel ban that the World Health Organization and others have raised is that it sends a punitive message to China. Now, China has been pretty forthcoming about what's going on the ground with the virus. It's a big contrast to past outbreaks like the SARS, where they were heavily criticized for not sharing information. And so now this travel ban that could really impact them economically is being imposed, and public health officials question, is this really doing anything? Because now that the virus has spread to so many other countries and has appeared here in the United States, there are confirmed cases. Does it make sense to ban travel from China specifically? With the other pieces of it, with the mandatory quarantine, public health officials, some of them, say that a voluntary or self-quarantine is a better idea because there's a high rate of compliance. People generally don't want to infect their communities. They generally obey and stay at home. This has been tested in many past outbreaks. And when you order a mandatory quarantine, if people know that they're not going to be able to go home, if they're going to be held on a military base, which is what we're seeing now, they might not be honest about where they've traveled or whether or not they have symptoms. And so there's a fear that those passengers might not be honest. There's a fear that countries might not be honest in the future about outbreaks if they know they're going to be hit with these measures.
You know, it was interesting. There was a press conference last week in the World Health Organization. Really, it felt to me, was very careful in not saying, China, this is your fault. You know, they did not want to put the pressure on China on this one. I'm curious what lawmakers and officials there on Capitol Hill are saying about the Trump administration's response to the outbreak, and also how this could affect relations with China.
Yes, there's a lot of concern about how it could affect relations with China and how it's already affecting relations with China. The Chinese government has criticized the U.S. for imposing the travel ban, and right now we are still waiting to find out whether or not epidemiologists and health officials from the U.S. will be allowed to participate in an upcoming World Health Organization delegation to China. They haven't said that they have not allowed that to happen so far because of what the U.S. has done, but it does raise the question, and lawmakers, including at the hearing later today, will certainly discuss whether or not these measures are backfiring by impeding diplomatic cooperation with China at this crucial juncture.
Look forward to seeing what more is said on Capitol Hill today in that hearing. Alice Miranda Ollstein, thank you very much for joining us.
Thank you.